Ethical debate, collaborating with other professionals.
Hi, my name is Hannah. I've worked in the field of ABA for 2.5 years now with ages 3 to 21 in the clinic. I enjoy working with the younger clients to see the new skills that they learn, but also enjoyed my time working with young adults to teach them job skills. My job role in this project was summarizer and fielder.
Hi, my name is Madison Beatty. I graduated from the University of Alabama with majors in communicative disorders and psychology. I've worked as an RBT for about 2 years now. I've worked in home settings, clinical settings, school settings, and community settings. I'm a BCBA candidate with projected graduation in May of 2024, and my role in this group project was the illustrator.
Hi, my name is Kristen, and I've worked in the field of ABA for the last 6 years, 3 years as an instructor therapist and 3 years as a senior therapist. Primarily, I focus on working with children ages 3 to 6 on foundational school readiness skills as they
Hi,
transition
my name is
to
Brooke Stout,
kindergarten
and
or
I have
grade
worked
1
in
for
the
the first
ABA
time.
field for almost 5
During this
years.
project, my
I
role was
have
a
worked in
researcher
different
on the pro
settings such
study.
as clinic, home, schools, and community. Most of my clients have been anywhere from ages 2 to 6, with a few that were age range 10 to 15. I enjoy early intervention and watching my clients flourish on a day to day basis. And for this project, I was the introducer.
Hi, I'm Emily Whelan. I've been working in ABA for about 4 years now, largely in early intervention. I have experience in clinics, schools, and home, and I'm also the music director at the clinic where I work. I enjoy using my degree in music and theater to help teach social and other
So,
skills.
what is autism
And for
spectrum
this
disorder?
debate, I was
ASD
the
is a
researcher
developmental
of the
disability caused
commons.
by differences in the brain. People with ASD often have problems with social communication and interactions, as well as restricted or repetitive behaviors or interests. People with ASD may also have different ways of learning, moving, or paying attention. There are different levels to the spectrum based on severity and how much support that these individuals need in their everyday lives. Level 1 requires support, level 2 requires substantial support, and level 3 requires very substantial support. Per the CDC, 1 in 36 children are diagnosed with ASD. 2 years ago, it was 1 in 44, and they predict it to remain the same through 2024. A little bit of background information. In this debate, we are going to be discussing collaborations with other professionals. We'll go over some pros and cons to topics relating to prioritizing the individual and creating goals to best support their needs, being between speech pathologists, occupational therapists, ABA, teachers, mental health professionals, etc. Having a large multidisciplinary team and weighing the cost benefits and scope of competence between professionals working collaboratively. There are several different types of therapies that are utilized throughout the community. To name a few, there's animal therapy, there's also art therapy, mindfulness, relaxation therapies, music therapies, and ABA. Applied behavior analysis is often used in conjunction with occupational therapy, physical therapy, and speech therapy. And you'll hear more about that later in our presentation. It is important that all of these different types of therapies that specialize in other disciplines are able to collaborate and work together the best way to assist the client. There are many benefits that come with collaboration, and there also are some barriers. And as we move through this presentation, Emily and Kristen will discuss these points more thoroughly.
This debate will discuss collaboration between professionals. However, the focus will be on ethics. One challenge in discussing ethics and collaboration is that ethics codes may vary across disciplines. In this debate, we will focus on the ethical guidelines by which we are bound by the BACB. However, before we begin our first debate point, I would like to outline the ethics codes for speech-language pathologists and occupational therapists to demonstrate the variance of ethics codes across professionals. According to the American Speech Language Hearing Association's 2023 Code of Ethics, There are 4 principles
The lack of cultural
ethics
humility
SLPs
within our
must abide
profession
by.
has concerned
These 4
many behavior
principles are
analysts
listed
as
on
well
the
as other
screen.
scientists and
According
sparked
to
many
the
arguments
American
regarding
Occupational
ethics.
Therapy
In an article
Association's
by Kirby and
2020
others in
Occupational
2022,
Therapy
they
Code of
explore their
Ethics,
opinions on the
occupational
importance and
therapists
urgency
should
of
abide by
collaboration
6
among
principles,
behavior
7
analysts and
standards
healthcare
of
workers,
conduct,
mental
and
health
7 core values.
clinicians,
Each of these
educators,
components
and
are listed
other
on the screen.
professionals.
Finally,
She
I will
highlights
discuss
the
the
idea
ethics
of
by which were
disciplinary
found by the
centrism.
BACP.
She
Not
suggests
be
we move
highlighted
away
throughout
from
this video.
disciplinary
According
centrism
to the
and
BACP
towards
2020 Code of Ethics,
humility and
behavior analysts should
collaboration,
follow 4 core principles.
as demonstrated here
Those
in
being
Figure 1.
benefit
4
others,
key areas
treat
are
others with
highlighted:
compassion, dignity, and respect,
values and
behave
ethics,
with
teams
integrity,
and teamwork,
and ensure their
communication, and
competence.
responsibilities. Kirby relates each of these values to the ethics code provided by the BACB. Kirby brings up the counter-argument some behavior analysts hold in regard to collaboration. Although some behavior analysts favor the idea of collaboration, many believe the evidence within our field supports their own assessments and treatment recommendations without needing the support of other fields' evidence. The ethics of collaboration are key to our field. However, this is an often debated topic. Is it ethical to take
Here
the
are a
risk of
couple of
overshadowing
ethics codes
behavioral
that
therapy
relate to this
and
part of
commit
the
to finding a way
debate.
to integrate? Or is it more
1.05,
ethical to lean
practicing
on our
within
own
the scope of
understanding,
competence,
evidence, and
as well
independence?
as 2.10, which is collaborating with colleagues.
Kristen and Emily will now review the pros and the cons of debate point 1, prioritizing the individual and creating goals to best support their current needs.
When working with a vulnerable population, it is imperative to utilize outside professionals such as speech and language pathologists, occupational therapists, teachers, and mental health professionals to gain full insight on the client as well as insight of the provider's professional opinion across many areas of need. Like Donaldson and Stammer state, when comparing SLPs to ABA therapies, many components of ABA are reciprocated within the field of speech and language pathology. Although the terminology may differ, the core principles remain the same or very similar. Seeking additional supports in areas less familiar to the ABA professional ensures better understanding for the child's needs and requirements to obtain skills and development. Each individual with autism is unique,
Yes,
and
Kristen, we
ABA
are
professionals
bound by
alone
the
do not
ethics
have the
code to
knowledge to
seek out the
support all the
expertise of
needs of
others so
a
as not to
person.
operate outside of our own
According to
scope of
Schreck and
practice.
Mauser,
However, despite best
families are
intentions,
often
collaborations
seeking
may fall
multiple
short of
professional
achieving
opinions
their
when
ambitious
selecting
goals.
services to better
The
understand their
workplace
child's
is
needs.
no Shangri-La.
Therefore, as a professional working with the learner, you
Collaboration may
also should seek
inadvertently lead to a
additional
less
services
tailored
when
plan,
providing
one stacked
treatments,
in favor
interventions,
of a
and when
specific
working on skill
professional or
acquisition.
therapy, or a one-size-fits-all approach to satisfy all providers. For example, according to an article by McClaney and others, interdisciplinary teams may intentionally put broader, less individualized interventions in place so that all providers can meet more of their own treatment goals. The Agency for Healthcare Research and Strategy showed that the priorities of patient care differed between members of the healthcare team, and that the verbal communication between team members was inconsistent, creating an unbalanced, imprecise, or incomplete approach. In fact, several studies in the past 15 years, including Liberati and others, Jorgensen and others, Newton and others, Nugis and others, and Schiebel and Watling, have highlighted collaborative concerns, including professional boundaries, clinician role confusion, and leadership issues. All of these can hinder effective team relationships and goals and obstruct a cohesively individual approach. Moreover, as pointed out by Lemieux, Charles, and McGuire, despite common themes among disciplinary teams, each team is unique. Healthcare workers should not be forced to make compromises and treat by consensus. This can lead to a more generalized and less patient-specific healthcare, which I, for one, do not support.
Yes,
agree
but
that a
professional
treatment plan needs to
collaboration is
include
part
the
of the job,
flexibility to
and each
alter one's
professional should have the
approach
same
as the treatment
outlook, which is
progresses.
providing the
But
best
surely
care
Slim
and
and Reuter
services
Yule did not
with the
mean that a
best interest of
cohesive
the
initial
client in
proposal
mind.
was not also
Like
necessary.
Slim and Reuter
This
Yule
important
state,
cohesion can be
a
difficult to
final
create
agreement
across
or
disciplines.
consensus is not needed to
ABA is
proceed
a
with an
specialized
intervention.
discipline with its
Rather, that
own
each
principles,
member
methodologies,
can
and
support
standards.
in their own way
It
with
relies
useful
heavily on
information and
evidence-based
contribution,
practices and data
providing a
collection.
wide variety of
Other less
insights
empirical
and potential
disciplines
service
might
directions.
inadvertently prioritize their own
Without
approaches,
insights from an
leading to a
outside professional,
decreased
you would
depth of
breach your
ABA
scope of
knowledge,
practice
which
and
could reduce
potentially your scope of
effectiveness of
competence,
ABA
ultimately
interventions.
providing a disservice to
According
your
to a
client.
study by LaFrance
As
and others,
Broadhead
there can
states,
be
to grow your
blurring
scope
of
of
roles
competence, there
or
are many
dilution of
components
treatment
to consider.
impact in a multidisciplinary approach.
Education, practice, and experience
Inadvertent
are all
blurring or
important in growing
dilution of one
yourself as a
approach or another
professional,
is
and
not in the
without
best interest
utilizing
of the
others'
client.
knowledge, your experience will be
There is
limited to what
need
you
for
have read.
careful consideration of
Each
collaborative
professional, such as a
dynamics to
speech and
ensure
language
alignment of
pathologist,
other disciplines'
occupational
approaches and
therapist,
ethical
teacher,
codes
and
with
mental
those
health
of the
professional
BCBA.
hold knowledge in their
Further
own scope
empirical
that will
research on the
directly
impact
impact
of
learner success
multidisciplinary
and
collaboration will
development,
be necessary
and with
in
that
order to guide
collaboration, it will
effective
make a
collaboration
stronger, more whole
strategies.
ABA intervention
Broadhead is
when
wise
outside
to
perspectives
suggest the
are considered.
adoption of a strong decision-making model in order to assist the BCBA in addressing non-behavioral treatments while maintaining their ethical responsibilities. As Maddie illustrated earlier, there have been efforts from various disciplines to create a more comprehensive structure for collaboration in healthcare. Maddie described one of the many proposals earlier in the debate. However, at this time, there is no such universal structure in place across disciplines, which can frustrate providers, put clients at risk, and in our own field, for which we should be advocating, could lead to dilution of ABA principles and treatments.
I can see how there are potential problems that will arise when dealing with a large team with multiple views and levels of experience. However, according to Coons and Machulik, using a large team of professionals supports creating a diverse set of goals, in which in the end is the underlying objective when providing services to a client. In the end, the ultimate goal of providing ABA services is for a learner to reach their highest potential in not addressing concerns such as speech development, sensory components, or mental
Of
health
course,
status,
addressing all
as well
domains
as
is
academic
important.
skill set, would
However,
be
the
providing a
successful
one-sided
execution of
behavioral approach to
shared
the
goals
individual's
aligned with
learning
shared
trajectory.
decision making is a
ABA is
lofty
one component of
expectation.
intervention that is able to
Furthermore,
support an
ABA
individual.
interventionists
Leaving
have
out
the
the
unique
other
skill
vital
set to
components
create
would be
a
doing a
treatment plan
disservice
that
to the
does, in
client and
itself,
may
in fact,
negatively
target
impact them
all
in the future.
domains through behavioral
Taking the
interventions.
time and
If
effort
a
to
client
collaborate
chooses
will
to seek
ultimately
additional
ensure
treatment by
all
an
goals are aligned from
SLP,
the onset of
OT, or
service.
other professional,
According to
along with their
Slim and
ABA
Reuter Yule,
treatment, that is, of course,
collaboration
their
works on
right.
the basis of a
However,
shared and
each of these
aligned goal
treatments and treatment plans
with a
take
shared
time to
decision
develop and
making to work through
execute.
some of behavior
It takes
analysis'
time to
most
find the
complicated
provider,
issues when
time
working
to
with
get the
ASD
appointment,
clients.
time to create rapport, time to assess the client, time to develop an intervention, and time to assess the outcomes. There is a wealth of evidence, including a study by Lindstedt and others with nearly 1,500 study participants, demonstrating that higher ABA treatment hours correlate with greater success in achieving positive outcomes across various aspects of behavior. In fact, that specific study found impressive gains across academic, adaptive, cognitive, executive functioning, language, motor, play, and social skills solely through ABA interventions. A study by Virués Ortega reported on the importance of both treatment intensity and duration in ABA. They found that a higher treatment intensity of 36 hours or more per week predicted significant gains in intellectual functioning, language, and adaptive behavior, as opposed to fewer treatment hours. This research suggests that a greater number of hours spent on ABA sessions positively impacts progress and enhances skill development across the board. The more hours that are spent on other therapies, the less time there will be for ABA interventions.
Emily, you mentioned that collaboration is best for the client, but mentioned it is not well executed. Can you describe how collaboration can be poorly executed?
Collaboration has the potential to be good for the client, provided the collaboration is conducted effectively, efficiently, and ethically. Specifically in ABA, it must also be empirical. According to a 2021 article in Behavior Analysis and Practice, Gazewski and others state that most BCBAs believe that they have an ethical duty to question and identify non-evidence-based interventions as ineffective. Questioning other professionals regarding their use of EBP can lead to misunderstandings of intention and breakdown in successful, effective collaboration between BCBAs and other providers. Furthermore, according to the same survey, the use of behavior analytic terminology by BCBAs across disciplines has acted as a deterrent to effective collaboration due to unfamiliarity and inconvenience expressed by specialists from other fields while communicating. This lack of communication can lead to misuse of valuable time and resources of all involved and mistargeting of goals and treatments.
Kristen, how do you think collaborating with other professionals can be balanced so the effectiveness of ABA practices is not diluted for the learner?
According to Coons and Machulik, teamwork needs to be prioritized when the ultimate goal of success for a learner is being maintained. Collaboration only works when there's a terminal goal and each professional is working towards it in a peaceful and collaborative way. Understanding the pieces of the puzzle rather than one idea is superior than another. There may be times when other professionals' ideas are at the forefront based on the nature of the problem being addressed. However, with each case conceptualization, a unique combination of ideas and treatment options will need to be discussed to ensure all components of the multidisciplinary team are addressed.
Debate point 2 will discuss having a large multidisciplinary team and weighing the cost benefits. To provide background information about this topic, I will define a multidisciplinary team along with what it entails. I will also define the values of an effective
These are a couple of
multidisciplinary
ethical
team. It is common
codes
in the field of ABA
that
for a
pertain
client
to
have
this part of the
less than
debate.
one
2.12,
multidisciplinary team.
considering medical
According
needs,
to the NSW
3.05,
government,
financial agreements,
a
and
multidisciplinary
3.06,
team
consulting
is
with
defined
other
as a group of
providers.
healthcare professionals from various backgrounds and disciplines that work together to serve at least one client. For example, a multidisciplinary team in the field of ABA could comprise of a BCBA, a speech-language pathologist, and an occupational therapist. The NSW government also explained 3 key factors that would make an effective multidisciplinary team, those being care, collaboration, and communication. Along with these 3 factors, the NSW government explained 4 values that define an effective multidisciplinary team, those being effective communication and collaboration, respect and trust, solid implementation strategies, and transparency. It is important to ensure that a multidisciplinary team communicates effectively to establish potential concerns and changes in a treatment plan. It is also important for a multidisciplinary team to collaborate productively.
Coordinating a team of specialists to work with a child with autism can be pricey and logistically complex. Integrating a large number of providers from different disciplines can prohibitively raise the costs due to coordination, training, and collaboration. Unfortunately, according to an article by Corcoran, these financial burdens may strain families and other stakeholders, such as school districts, that lack sufficient funding resources. Families bear the brunt of higher costs. For example, the Family Experiences with Autism Survey data is employed to pinpoint elements linked to financial difficulties in families raising a child with autism. The data shows that the probability of encountering financial problems was higher when families sought out medical treatments. Most families have uncovered medical or therapy costs. Furthermore, a considerable number of survey participants sacrificed their long-term financial stability, and some even went bankrupt to secure various therapies for their autistic child.
2021 and generated
Treatment
a
by
graph
fewer providers
demonstrating
would save time
professional
and money
development
for these
towards
families, according to Sharp and
teaming.
Baker.
This chart
Additionally, the strain and
gives
confusion
suggestion
that
as to
consumers
what
may
steps
face
to
when
take
dealing with
toward
large
interdisciplinary
multidisciplinary
training.
teams must
Once
be considered.
confidence is
Therefore,
established
in
one's
cases
own
where a single
profession,
discipline
which you see
approach
on the
is
bottom
sufficient,
step,
the additional
professional
expenses may
practices
not
their
be justified.
expertise and seeks additional knowledge.
I have already
That's the
addressed
second
the fact that
And
long-term,
the last step
comprehensive
of the visual,
ABA
the professional can then
intervention led
effectively
to
practice
positive
team
effects in
characteristics
all
such as
areas
a shared
addressed
vision,
in many studies,
communication,
including
trust, and
intellectual
collaboration
functioning,
to
language
further
development,
broaden their scope
acquisition
of
of daily living
competence.
skills, and social functioning in children with autism. If ABA can produce these results without the added time and expense of collaborating with other professionals, this approach should take precedence, as it is
I will
both
now
efficient
introduce Emily,
and
who will
effective.
present the cons of having a large multidisciplinary team and weighing the cost benefits. I will also introduce Kristen, who will present the pros for this debate point.
Your concept that ABA professionals can hopefully provide adequate services without the use of an outside professional is shocking, and the potential for harm or disservice remains high. Sitting around and waiting for your potential barriers to surface to the point where then you need to call in professionals seems very counterproductive. You will waste time and money on an ineffective treatment without bringing outside
Collaboration
professionals
itself
that
is
could
a skill,
support
as you
earlier
so rightly
diagnosis
pointed
and
out.
suggest a more appropriate intervention
Unfortunately, it is a
plan
skill that
from the
many
onset of
professionals are
services.
expected to intrinsically
If you
possess,
consult at the
despite little
onset,
training
you
in
will
the
be able
area.
to rule out potential barriers
Collaborative models are
early on and provide a
increasingly
more narrowed in
popular,
approach when it
but in
comes to
applied behavior
intervention.
analysis, the lack of
Collaborative
formal
approaches
training
can
in
benefit from working
collaboration
together
hinders effective
to
teamwork,
seek out
as
additional
noted by
information
Kelly
that
and
one professional
Timpani.
may have
As
overlooked
Hannah
based on their
explained
experience
earlier,
alone.
most disciplines are
According to
trained to
Donaldson
follow
and
their
Stammer,
own unique ethics
81% of
codes
children
and
diagnosed with
standards.
ASD receive
They're unlikely to
support
be
through
educated on
schools,
others.
and 90% receive
Even the
support through
terminology
speech and
surrounding
language pathology.
collaboration can be a barrier. For
Donaldson and Stammer
example,
also
many
state
professionals also
that over
misuse
a short
terms
period of
like
time, the usage of a
multidisciplinary,
multidisciplinary team
interdisciplinary, and
continues to grow.
transdisciplinary
Knowing that
collaboration,
information, why
or
would
use
we
them
choose to avoid
interchangeably.
collaboration,
But
knowing
they
the majority of
represent different
ASD
levels of teamwork.
population
Which level are we
utilizes
striving
multiple
for?
services to benefit them?
Schreck and
As
Mazur
Coons and
highlight the mix and
Machulik
match treatment approach that might
state,
stem from
collaboration
confusion
ultimately is
surrounding
the
these
best
terms and
solution
their
for a learner.
expectations,
And to be
and say that it
successful at
leads to
collaboration, you need to
substandard
gain skills
outcomes.
in the following
For true
areas:
collaboration, aiming for
acknowledgement,
the highest
acknowledgement of
level,
each
which is
professional's values and
transdisciplinary
team-focused
collaboration, is
contributions.
essential. Transdisciplinary treatments emphasize the importance of fostering deep understanding of the subject matter within each discipline for everyone involved. This means that individuals from various academic backgrounds need to comprehend and appreciate the core concept and principles of all the related disciplines. This approach should encourage a comprehensive understanding of the interconnectedness of knowledge and promote effective problem solving and innovation through the shared expertise of all participants. Unfortunately, as Gerenzer and Koenig emphasize, the more common buffet-style approach impacts the treatment process negatively and results in minimal gains for clients.
At the end of the day, working as a collaborative team with other professionals will be unavoidable. The skill acquisition of working collaboratively falls on the professional development of that individual. And that development will aim to avoid that buffet style approach you mentioned. As stated previously, a need for a large multidisciplinary team is needed, so why not practice and master the skill of team collaboration from the beginning? According to Gasiewski, the most effective interventions include personal judgment of multiple professionals as well as the values of the family and the best research. As Coons and Matchlick state, there are three components to collaboration. Number one, review, where each professional is able to discuss their success and barriers, providing a space for others to interpret potential barriers and solutions. Number two, problem solve, where all professionals come together to prioritize and come up with a solution-based focus. Number three, pivot, where progress is monitored and discussed, where things are working and a continuation of the progress plan is created. When things are not working, a shift in idea and focus are tried. This system ensures all professionals remain goal-focused for the benefit of the learner.
You state that collaboration is unavoidable, but this may not be the case. It is impossible to predict whether a large multidisciplinary team will be needed in the future. Why introduce such a large, possibly redundant team up front when it could just lead to conflict? According to an article by Gasiewski and others, there is a risk of breakdown in collaborative care when multiple disciplines are introduced. They further go on to assert that in such collaborative efforts, conflicts between providers may cause a delay in services, and delays cost money. Delays can stem from many areas, including deciding which client goals to focus on, which interventions to adopt, and assignment of who should assume what roles. As noted by Woolry and Bredekamp, the differing philosophies between fields may result in time and money wasted on disagreements.
Emily, you were saying that there is too much cost up front. However, it is known that early intensive intervention is more beneficial. Although it costs more upfront than a less intense schedule of services, in the end, a less intensive or later onset of intervention will end up costing more, as it will take more time across years if early intervention is not provided. According to Lindstedt and others, treatment intensity as well as treatment and early intervention holds success with mastered skills 60% above those who receive services at a less intense or at an older age. These results include higher academic skills, language development, executive functioning, play and social skills, motor skills, as well as cognitive flexibility and understanding. Having a multidisciplinary team at the onset of services ensures that all areas of development are assessed at an early age so interventions can be applied in a timely manner. According to an article written by Bowman and others, it states that effective collaboration can elevate problem-solving techniques, which in turn increases efficiency in programming and intervention. At the end of the
A
collaboration, if
couple of
no other
ethics
benefits are
codes to go
seen,
with this
you at
part.
least have built a relationship
2.01,
to access
providing effective
additional
treatment,
resources in
as
the
well as
future.
3.08, responsibility to the client with third-party
However,
contracts for
providing
services.
individuals an early start to treatment can be beneficial for them and stakeholders. Is there a time when you think that these potential costs are outweighed by the potential benefits? If so, how do you think professionals can collaborate to best serve the client, offer them higher potential benefits?
I think that having a team collaboration, including all relevant stakeholders, such as the parents, is imperative to prioritize skill development. When looking at skill acquisition, you need to address prerequisite skills in order of importance that will have the most impact on the learner. For example, prioritizing academic skills for a learner who does not have functional communication and engages in high rates of challenging behavior will be a waste of money for the parents. Understanding the most impactful route of intervention will support utilizing funds in the most productive manner. According to Schreck and Mauser, the effectiveness of a treatment lies in the data of the behavior change, but additional considerations include ease of implementation across environments, cost effectiveness, and generalization.
Emily, how do you suggest professionals to effectively collaborate with each other?
Creating a standard decision-making framework would be a good place to start. As Kristen mentioned, we need to recognize there will still be disagreements. We need to teach practitioners across various disciplines to critically evaluate research, understand the rationales regarding interventions from different disciplines, and to be
According to the
respectful
article,
but
a
straightforward
call
when
for
questioning
discussion about
interventions.
scope of competence
Soft
and behavior
skills matter
analysis
too.
by Broadhead Competence
These include
refers to an
recognizing
individual's
ways in
ability
which
to
we
demonstrate
ourselves may
knowledge
have
and
failed
technique to a specific
collaboratively in the
mastery level.
past.
The
Let's prepare
BACB
our professionals to
Ethics Code
collaborate
refers to one's
effectively,
scope
but
of
also
competence
to
and
approach
enforces practices
evidence-based
within one's
practice
scope.
in a cohesive and
Practicing
efficient
outside your
manner
scope of
across
competence is an
diverse
ethical
healthcare settings.
violation.
The next
Each
debate
professional
will
is
discuss
responsible
scope
for
of
growing their
competence
own
between
scope of competence
professionals.
daily
To
with
provide
on-the-job
background
learning, additional
information on
training, and
scope of
education,
competence, I will first
as well as
define
literature
what
reviews.
practicing
But
in one's scope
how
of
does one
competence
continue
entails,
to increase
and
their
then
scope of
provide
competence
background
outside their
information on
job
how
requirements
professionals can
to further
continue
their knowledge?
development of their scope
A
of
great
competence.
resource to learn
According to
from includes
Broadhead
other
et al.,
professionals, which
scope
can
of
come from
competence is defined
collaboration.
as the range of
Broadhead and
professional
others
activities
state
of
that
an
applied
individual
training opportunities
practitioner that are
result in
performed
different
at a level
competences across
that is deemed
professionals.
proficient.
In
An
the case of
example of
professional
practicing within
development
one's
and
scope of competence
collaboration,
would be a BCBA implementing
knowledge
a
and
skill
expertise
acquisition
coming
program
together
after
to work
adequate
towards a
training.
common goal not only
Broadhead et al.
benefits the
also
learner,
explained various
it will
ways
also
to
grows
continue
each other's
ongoing
scope of
development of
competence
one's scope of
across
competence
multiple
for behavior
domains.
analysts, which include coursework in literature mastery and supervised practical experience. In the article, A Call for Discussion About Scope of Competence in Behavior Analysis by Broadhead et al., coursework in literature mastery involves reading published research articles and continuing professional development. Examples of professional development include conferences and completing continuing education units, also known as CEUs, for behavior analysts. Another way to continue development of scope of competence that was explained by Broadhead et al. Is through supervised practical experience. Broadhead et al. Also explained supervised practical experience as gaining knowledge and competence through directly practicing implementing procedures. Furthermore, Broadhead et al. Explained to continue ongoing improvement of this, behavior analysts can participate in peer reviews to receive feedback from professionals about their work.
In this table, Figure 3, generated by Shoaib and others in 2021, we see the prevalence of comorbid diagnoses alongside an autism spectrum disorder in two separate databases, Optum and MDCD. These diagnoses include neurological conditions and psychological
Surely,
conditions.
ABA providers are bound
ADHD is
first to
observed to
keep
be the
abreast
most
of
common
ABA.
comorbidity, followed by
Excessive
mood
emphasis on
disorder and
interdisciplinary
anxiety.
collaboration may divert time and
Developmental
resources
delays are
away
also
from
common.
mastering the
Given this
foundational
data, we
principles
can
of this
conclude
field.
individuals on the
Carr and
spectrum will see
Briggs
many
note that
professionals
behavior
in
analysts
addition
must
to
stay up
behavior
to date with the
analysts.
scholarly literature
Combinations of
surrounding
therapy
ABA
and drug
in
treatments
order
are
to adhere
common
to the conventions and
with
guidelines of the
patients
profession.
with
Maintaining
ASD.
this
When referencing the
competency
ethics
in
code,
ABA
providing effective
is crucial
treatment
for
may or
effective
may
practice,
not mean
and many of
collaborating
us
with
may
other
feel overwhelmed
professionals.
even by this responsibility in our fast-growing field. Add to that the time and care it would take to learn the jargon and philosophical underpinnings of many other disciplines, and we could be left with providers who are
Kristen
jacks
and
of
Nolan
all
will now
trades,
explain the
masters
pros
of
and
none.
cons of scope of
The growing
competence
prevalence
between
of
professionals
interdisciplinary
working
teams
collaboratively.
creates the need for what could be an insurmountable amount of time and resources to be committed to areas of expertise outside of a BCBA's scope of practice and/or competence. You mentioned the Broadhead article, which also states that the responsibility to determine one's own range of professional competence lies with that individual. However, is it really appropriate to entrust an individual with this task of self-assessment? After all, the article goes on to report that most individuals may lack up-to-date performance metrics such as accuracy and fluency for every professional task they undertake. Practitioners, therefore, are likely to assess their competence by reflecting on their own personal experiences. However, it is essential to recognize that merely undergoing these experiences does not guarantee competence. Given this, can we confidently assert that every behavior analyst has the appropriate understanding and perspective to accurately
I would
define
argue that the idea
boundaries
that
of their own
collaboration can look
competency.
many ways is
I
part
would
of the
argue that
problem.
the answer is
As I mentioned
no.
earlier, there is currently no
Scope of
standard
practice
model of
refers
what
to the
collaboration should
activities
look
that
like,
licensed
and this can create
individuals are
issues.
permitted to perform.
According to Broadhead,
This
various
is often
practitioners
determined
involved in
by
a client's
the
collaborative
individual
care may
state
not be influenced by the
legislatures
same
or
definition
by
of evidence-based
appropriate
practice.
licensing agencies.
They may not be familiar
Why
with
should
each
proof
other's
of
language.
competency
They
be
may favor
so
their approach
comparatively
over those
vague?
from other disciplines.
Science-based
Increasing
practice
scope of
should be our
competence into
standard.
treatment areas
I
beyond
understand that
our own
practicing
may be
outside your scope
helpful,
of
but
competence is
who
an
will be the
ethical
judge if
violation.
competency has been achieved?
However, increasing your scope of
Furthermore,
competence
collaborating
to
on
include
treatments
other
that are not
professionals'
evidence-based
perspectives
could be seen as
is
a
not
violation
practicing
of our
outside your
ethics
scope,
code.
rather understanding different
ABA has the
ideologies,
advantage of being a
standards, and
specialized service
practices
that
that may
individualizes
impact your
treatments
clinical
while addressing
judgment
a
and
large number
decision-making
of
about
domains,
an
and
intervention.
ABA's dedication to
Utilizing
data-driven
information
decisions
you have gained
helps
from
to
other
make it a
professionals
superior
may
treatment.
support your recommendation
Until there
to
is a
seek out
clear
other
roadmap for
professionals to collaborate
collaboration,
with on a
it could
specific
cause more
case.
harm than good.
According to Reader and Zafir study on collaboration within the healthcare system, the quality of treatment increases when collaboration with multiple professionals occurred. They claim success lies in shared goals and that collaboration supports clear objectives across relevant parties. Time should be spent on collaboration and searching for a common goal across all professionals that are deemed necessary. Collaboration doesn't need to take a significant amount of time to conduct. According to Bowman and others, collaboration models can look different for every professional in every case. There might be some professionals that require more frequent meetings, observations, and collaborations, but often professionals' collaborations can consist of infrequent meetings after the onset of service. Bowman and others state that there are no guidelines for how much or little collaboration needs to take place, rather than a needs-based model that is determined by a professional and other relevant stakeholders. LaFrance and others' research study on multidisciplinary teaming, enhancing collaboration through increased understanding, concluded that collaboration with multiple professionals when working with children with ASD is mandatory, as comorbidity diagnoses are increasing. Individuals on the spectrum are often utilizing multiple different professionals to address areas of concern. Therefore, collaboration is key to success to have the most positive impact on the client. LaFrance and others believes that having an understanding in others' professional scope of competence will benefit services across the board and build a better and stronger team. Kristen, how can practicing within your scope of competence be beneficial for the client?
Practicing within your own scope of competence is beneficial to the client because you have met the criteria by educating yourself with coursework and literature, practicing technical skills, received supervision on practical experience, and continue to refine your personal skill set for the benefit of your client. just like Broadhead and others describe. Although scope of competence is a personal journey and it is deemed successful with comfort and confidence in implementing your skills set by the individual. It is beneficial in the sense that you have done additional learning to support the client and the intervention you are implementing, and are actively seeking new opportunities to grow within the field of ABA.
Emily, what do you think is the most effective way for professionals to expand their scope of competence? Collaboration with other professionals can be helpful for clients, but you stated it can divert time and resources.
To save time and resources, the field should consider integrating joint training sessions where ABA professionals and those from other disciplines can learn about each other's roles and expertise at the same time, rather than each profession trying to search out this education independently. We can establish regular interdisciplinary team meetings where ABA professionals and those from other disciplines can discuss shared cases, exchange knowledge, and develop integrated, evidence-based intervention plans. Furthermore, we can try to encourage joint development of intervention plans for all clients, where ABA professionals and others collaborate to create cohesive and integrated plans that maximize the benefit of all disciplines before co-treatment begins. Most importantly, we should all work to establish clear guidelines for what collaborative practice should look like.
In conclusion, there are many benefits to collaborating with professionals outside of our field, although there are also many barriers. The BACB provides us with an ethics code as well as many core principles. However, after being presented with both sides, we can conclude any attempts to collaborate should be handled uniquely and by carefully examining how ethics could be applied to the various situations and dilemmas.